Madison Memorial Hospital is the lone provider of acute healthcare services in our community. And when you've got a small hospital in a rural setting, it's often difficult to take care of critical care patients. We reached out to Intermountain Health and their telecritical care team to be a part of our team to care for our patients. The wonderful part of that collaboration is they are one call and one camera away.
It seemed like it was going to be a normal night in the ICU with some critical patients, but everybody seemed fairly stable.
When I came in and got a report on the patient, I learned that this patient had attempted suicide by taking 365 pills of Benadryl.
As the night progressed, things started to turn bad pretty quickly. As I was sitting one-on-one with her and she started having seizures, I started recording right away and thought, I need to call the doctor.
And so then that's all of a sudden kind of alarms going off in my head saying something's not right here. So we gave her some medicine to try to stop the seizure, and 5-10 minutes later she has another one, and then another one.
She didn't stop seizing. We tried some more Ativan, it didn't work. It was as we were getting ready to intubate that she coded at that point.
She loses a pulse, her rhythm changes, and so we check a pulse, there's no pulse.
We had to put a central line in, so we had a doctor from the ER come up to do that.
Did the typical ACLS, medicine, CPR, and that kind of stuff, as we're still trying to determine what really caused the arrest. Patient was an overdose earlier, had seemed to be improving, and then all of a sudden kind of started getting worse, so we're trying to figure that out at the same time. At that point, I heard a voice kind of behind me suggesting something. And that's when I kind of turned and saw the TV monitor on, and the nurse said, oh, that's the ICU doc from Utah who's helping to run and help direct things. I said, okay, sweet. And that person at that point, then we started to interact a little bit more as we kind of talked about options, what we could do.
The telehealth doctors were there giving a lot of advice and input on interventions that we hadn't seen done before.
They were working on all the kind of acute management right there, but I needed to know, okay, what else can we do? Quickly, I got poison control online because I thought this was related to her overdose to get any additional benefits. And I think that's actually where I was able to help out a lot because she got circulation back and we were just kind of stabilizing her.
I actually went home after the code to look it up because I was like, why are we doing this one? Anyway, and it turned out that it was a great intervention, and there are case studies that show that it's really effective, but it was nice to have that resource.
We don't have the volume, or the resources to have an intensivist full time. So to have, this tele-ICU service there the entire time on the screen where she's able to see the cardiac rhythm, give pointers, just constant advice through the whole process, it's huge.
And it's very reassuring, and it makes me feel like I can be a more competent nurse where I have other people that I can bounce things off of.
They weren't trying to outshine each other or anything like that. They all had good ideas to bring to the table, and we were able to implement them quickly with clarity.
The transfer of this patient was pretty incredible because the tele-ICU got on the phone and coordinated the life flight team to fly into Idaho Falls, which is a regional medical center about 45 minutes up the road. And had I been alone having to do all that on my own, we could have had a totally different outcome.
Critical care is a team sport. We all work together to help patients through a dire circumstance in their life, and she pulled through and came away from this pretty unscathed, I think, which was pretty amazing.
When I have these patients and I'm worried about somebody and it's late at night, I can rest easy a lot of nights knowing that I have somebody who's kind of watching over my shoulder if I need them. Somebody who's given me a second opinion, making sure I don't miss anything. And so for me as a physician, it's made a big difference.